Well, hello there. My name is Susan Hamilton, and you're watching OffBeat Business TV or listening to the OffBeat Business Show on the OBBM Network. We're coming to you from the OBBM Network studios at Work Suites in Allen, Texas. And today I'm talking with Dr. Daniel Wojnicki over here in Allen. And you've got a brand new practice after a 10-year stint over there in Flower Mound. So welcome to Allen.
Thank you so much. Thank you so much for having me, Susan.
You're listening to the OffBeat Business Show, rebuilding American business influence locally, nationally, and abroad, bringing you experienced insight for a strong, influential brand and successful life in business. Here's your host, Susan Hamilton.
Well, this is an exciting time because everything that you deal with and are going to see on an escalated basis from here on out has to do with recovery of the neck and the shoulders and the back and all the sitting. Are you doing a lot of sitting right now? I imagine a lot of the people that you're treating are.
You know, I see so many more people now that are coming in with similar complaints. And what I find is now that so many people are working from home, they spend a lot of time on the couch with their laptop open in front of them and day after day kind of hunched over the laptop, causing more and more discomfort around their neck and their shoulders and their lower back. And although they may have had some of these complaints in the past, they seem to have worsened recently.
You think? I've definitely noticed it in my family. Dr. Dan, do you have kids?
You know, I don't. My wife is pregnant with our first child.
Oh, how
right
exciting.
It is exciting. Thank you.
It's fun. Well, then you're about to see what it looks like from the inside out when that neck, those neck and shoulders holding that child.
Sure.
There's a lot of similarities, I find, in the position that I have when I'm holding my laptop, or not my laptop, but my iPad.
Yeah.
Or working in the kitchen and then picking up my grandchildren. And I start realizing that the neck and the shoulders get out of whack and I maybe not right away. I'll be going about my day and taking care of other things and realize, oh wow, somehow I've become stressed.
Sure.
I've become stressed in here. And I try and stretch that out. I know I'm not alone in that. I'm hearing people talk about it like crazy right now.
Absolutely.
And they need to know where their resources are. One of the things that we were talking about earlier are the fact that there are really three main problems most people have with the marketplace. And one is approachability. And I believe that in the chiropractic arena and massage therapy and maybe even with an accountant, there are certain companies out there that really need to have an approachability factor with their marketing because the marketplace might be scared of going even though they know they need to go. Do you know you need to see a chiropractor and you're just not going? Those things happen, right? And how long does it typically take for someone who's had a problem to finally come in and see you?
You know, oftentimes it takes a long time. And oftentimes what we see is pain is the last symptom of dysfunction. And so they've been having issues for years, and until the pain gets severe enough for them to actually come in. So people will adjust or just stop lifting things over their head or change the way that they'll do their dishes to avoid causing or creating any type of pain until, well, there's no more comfortable positions for them to get into.
Oh my gosh, is he talking to all of us right now? I can feel this.
And so unfortunately, that's typically when I'll see most patients is when it's maybe what I'd say a last resort. Mm-hmm. And like you mentioned, some people do have some fear or concern about chiropractic manipulation. And so I actually like those types of patients that come in so I do. So, you know, it's what we do is very comfortable and most patients get a lot of relief immediately. And so it's nice to be able to maybe remove some of those concerns that they have and get them the relief that they've been putting off for so long.
You know, I'm hearing different things. I'm hearing vertigo in the marketplace these days. I've never noticed so many people within a few short weeks talking about vertigo. I mean, we network right here in our studios. A lot of people are talking about that. That seems to be a common issue also. This is a strange time.
It is a strange time, and we do see more things like vertigo. And we also see that lately people have changed dietary habits. They're not nearly as active. There's a lot of weight gain. And so a lot of people are experiencing new symptoms that they may have not experienced in the past. And so things are showing up in our office that are a little unusual, like more cases of vertigo or lots of headaches or patients that we've treated on and off for a variety of conditions showing up with new symptoms.
I think with our kids going back to school, this will be interesting to see how the new lifestyle and a little less mobility is going to end up affecting them. That concerns me. I'm watching very closely as I've got two grandchildren going into school. Today is their first day.
Yeah.
So by the time this airs, there will have been a month past. So if you're hanging out with me on social media, let's talk. We'll find out what actually happened with that. But I think we're going to see more and more of pediatric need. Do you care for kids of all people of all ages?
I do. I take care of people of all ages, and it is important what you mentioned with kids these days. They spend so much time texting or on their laptops, and now with so many kids staying home from school and doing virtual learning, they're just going to be spending more and more time hunched over the computer. And so we start to see more problems and more complaints with younger and younger patients. And throughout my career over the last 10 years, that's been consistently true over year after year. It seems that I have younger and younger patients coming in with neck and back complaints.
So where did you go to school? Are you Parker or Palmer?
Yeah, I went to Parker. That's awesome that you knew Palmer too. That's where chiropractors, I think, originate from. But I went to Parker. I graduated there. Gosh, it's 10 years this month that I graduated from Parker. I loved my education at Parker. It was a great school.
We're glad to have you, no doubt about it. You are going to be helping so many people here in the Allen area, and I'm excited about that. So you decided to make an aggressive move with your business during a time when a lot of people were shrinking back. What motivated you to move into this space within the last 2 months?
Yeah, that's a really great question. And so I had an opportunity, and I worked in Flower Mound previously, or owned an office there. And just the way that things aligned, that a really great chiropractor had been talking with me for some time, and that had a family in the area that had some interest in my practice. And so he decided to take over that location, and I had an opportunity to show up here in Allen. And even though maybe the time isn't perfect with what's going out in the world right now.
Unless it is, it might be totally perfect.
It could be totally perfect. And so and honestly, for me, it has been perfect so far. I've been very fortunate to start in what many might think is a very difficult time to build a base or a patient base in a business. And I've been very successful with meeting several people from the community that needed and wanted the types of services that we provided. And so it's been a really great opportunity. I love the community here. Gosh, Allen is such a beautiful place. So I've been very happy to be here.
You know, the thing about great business is that it's solutions oriented. And so when you look into a community and you say, wow, I can see that this problem is there and it's going to get worse, and I can solve the problem. I believe I have studied and worked for the last 10 years to have a really great solution to this problem that I see. I just think that's a level of love that the community needs, and I think you can't fail in that. I really do. I think it's great to go forward no matter what other circumstances are around you. I really do, because if you're the answer to the problem and you shrink back and you don't, that's something you'll have to assess with yourself one day, and that's not easy. I think you regret the things you don't do.
I would agree with that 100%. And the truth is I wish that less people would be in pain and there would be less problems with spinal related issues and disc problems and nerve problems. But the truth is there's more and more and more of that. And so with the type of work that I do in the members of this community and most communities, there's a lot of people that require that type of help. They're dealing with issues that oftentimes they don't know what the appropriate solution is. They've seen multiple different doctors and just been given different types of medications or solutions that just didn't work for them. And so, I found with using an integrated approach, with teaming up with medical staff and having nice equipment and techniques and rehab, that I'm able to help a lot of patients that might not be able to find the solutions elsewhere.
That's fabulous. So tell me a little bit about your office.
Sure.
So I'm going to walk in and you've got somebody at your front desk. Do you have, how big is your staff?
Yeah, that's a great question. So right now, my staff is fairly small. I've just been there for a couple months. And so the first person you would meet is Alicia. Alicia is our front office coordinator. She's wonderful, very warm, inviting person. And so, you walk into my facility and I'm very fortunate to work in an office space that's brand new, beautifully built, just across the street from Lifetime Fitness in Allen. And so, the truth is it's got everything I've ever wanted to have in an office. And so Alicia is there to greet our patients. As we come down into the rehab area, you'll find Elizabeth, our rehab tech. Elizabeth coordinates most of our rehab protocols that we do, as well as our decompression therapy, coordinates patients with, the types of different treatments we do. Michelle is our nurse practitioner in the office, and so she will oversee a lot of the rehab that takes place, as well as offer different medical services. And then you'll find me down at the end of the hall. And so in my office is where our patients will get chiropractic manipulation, or we also do soft tissue work, or really whatever the patient comes in and needs. And so I like to look at it again as a larger integrative type of approach. And so it's not a one size fits all. If you come in with back pain, you might require more than an adjustment. You might need decompression and rehab. You may need to see the nurse practitioner depending on how severe your problem is. And so I like to be able to have all of these solutions to be able to help as many people that come into my office as possible.
Excellent, excellent. I'll tell you what, Dr. Dan, we're going to take a break and hear from a few of our sponsors, and we will be right back to talk more about your practice, because we talked a little bit earlier, and I've got some questions for you, and I'm excited to hear your answer. We'll be right back.
At Work Suites, get back to work your way. Business addresses, co-working, executive office suites. We really thrive on helping small businesses expand their horizons from simply working out of their home. What's really nice is we're flexible with our terms. We don't require you to sign a lease with us, go month to month, or stay a couple years. You may only need a part-time space. You'll have a full kitchen, covered garage access. This is the ideal way to work through the transition in your business and get you up to speed quickly. Private offices have dedicated Wi-Fi, furniture, 24/7 access. Call 888-445-9675 and check us out at worksuites.com to schedule your tour. You're going to love it here. 888-445-9675.
And we're back. You're watching Offbeat Business TV. You're listening to the Offbeat Business Show, and I'm talking with Dr. Daniel Wojnicki over here in Allen, and you've at allenschiropractic.com.
That's close. allenschiro.com.
Allenschiro.com. You're going to see that in the band underneath this video. Make sure you check him out, because as we were talking about before the break, he's got somebody to take care of you at every single level. And I think that's so important for the things that we see today. And we really appreciate you moving to Allen and taking care of the people here. And so decompression, you mentioned decompression. And I think a lot of us feel a little compressed. So that's interesting. And also, you seem relatively young. You're about to have your first child.
Sure.
And you're already saying, the weights on joints might add to the compression that people are experiencing. I noticed you mentioned a little bit about that in the break. And we thought that might be interesting for you to share.
Sure.
Because I used to lift weights all the time and really take care of myself. And of course, that gets harder the older that I get.
Yeah.
And now I'm closer to 60 than I, for me, I think I beat myself up that I'm not lifting weights, but it hurts more. It hurts more. It's not like it was when I was young. It just hurts. Seriously, if it's already hurting you at your age, then I'm going to give myself some permission.
Absolutely. And the truth is that as time goes on, there could be some more degenerative changes that we see throughout our joints, or we don't have as much cushioning or connective tissue. And that's a natural process that the body will go through, where our tissue is not quite as hydrated and oxygenated as it should be. But there are several things that we can do to prolong that as long as possible. But what I do notice, as you mentioned with people that lift heavy weights, or even a lot of patients that I'll see are runners or long distance runners. And we'll see over time that repetitive stresses on their spine, just like repetitive stresses in sitting at a desk every day, or any other type of thing that we do in this repetitive type of motion, will cause stress points across our spine. So for lifters, oftentimes I'll see that they have discompression around the base of their neck or at the lower portion of their back, which could lead to things like tingling in their hands or fingers, or possibly radiation down into their legs. Or my runners oftentimes come in because they have knee problems, a lot of times at the inside of their knees, and it's because they've worn away the connective tissue or cartilage that cushions those joints. And so we like to provide different services that try to recreate some of that space and provide some additional cushioning throughout the spine. And so when you talk about spinal decompression, I love spinal decompression. It's one of the favorite techniques and tools that I have in the office. And so what the machine does is it takes over what it would.
He just said he uses a machine for this. We have to listen in closer.
So I have a few different machines that are specific to decompress discs. And so commonly, the lower portion of our spine, I'll find a disc that should be thick and hydrated and filled with nutrition has worn away and is very dehydrated and could possibly be herniating or bulging out into the nerves that's causing pain and inflammation, or even numbness and tingling, or even loss of sensation or muscle strength. And so we like to use techniques that will get the body to start to pump those discs and bring blood flow and nutrition and hydration back into them, and do that over a period of time until their body can start to take over that function again. And we do that in combination with rehab and postural techniques to improve.
And a machine, you mentioned something about a machine. Just go a little bit further on that little sentence right there.
You know, the machine is, it would be very similar to what you'd probably imagine a machine that should decompress the spine. It literally starts to pull or create space. It's not painful. It's not like a.
Is it like a stretcher?
It's like a stretcher.
Stretches your body.
It's not quite like a, like a rack, I guess.
Nothing barbaric.
Nothing too barbaric. It's quite comfortable, but it is. It's a stretcher, and so it'll start to gently pull your hips away from the base of your abdomen to create space. Or if you have issues with your neck, it'll gently pull your head up away from your shoulders, which will help to pull back or retract a disc herniation or a disc bulge, taking pressure off that delicate neural tissue.
I bet it does.
And the great thing about that is it gives the nerve a chance to heal. Unlike many techniques that I've seen or used in the past, I haven't found very many other than decompression that's able to create enough space for long enough around the nerve that the nerve can actually start to heal. And so that's exciting for me as a practitioner to be able to help patients that really didn't think that there was many other solutions besides possibly some sort of operation or surgery.
I am so excited about that, because when you say the nerve and allows the nerve to heal, so many people think nerves can't heal.
Yeah.
And I'm of the mind that your entire body can heal. We are made pretty wondrously, and our bodies are made to heal and regenerate. So when I hear people talk about how their nerve can't heal, it's a hard argument, because I believe, yes, it can, and they will tell you, no, they've had the same pain for so long, they don't believe a nerve can really heal. And you're saying that you can actually, people can experience this a way that a nerve can heal because it's left alone, right? It gets some space. So now oxygen and blood flow.
Yeah.
I just love that, because it makes perfect sense to me and what I understand about physiology.
Yeah, the body is amazing. Self-healing, self-regulating. You cut your arm, the cut's going to heal. You irritate a nerve, well, it's going to stay irritated until you can take away any of the interference or any type of the pressure on there. So allow the nerve some time to start to regrow coating on it. And heal, there's obviously limitations that matter. There are some things that will not regenerate and not, fully resolve. But in my experience, in most cases, for most patients that come, they'll get significant amount of relief, even if they have a nerve-related problem.
So you may not get a whole lot of sports injuries this year, but maybe.
Probably limited this
you
year.
You might have had kids going from being sedentary to moving again.
Sure.
When they finally do. So that'll be nice that they can find you and find a comfortable place and somebody they can relate to. I think that's going to be really, really great for them.
Thank you.
So besides decompression, what are some of the other most popular modalities you're using over there?
Yeah, so besides just doing decompression types of therapies, we like to incorporate postural rehab.
Postural, yeah.
And so nearly every patient that I see these days has a postural distortion where their shoulders will start to round in, their head will sit a little bit forward over their shoulders. And we like to help teach patients techniques to start to improve that. And so I understand that in modern day society, most people are going to be spending a significant amount of time sitting in front of a computer or over a laptop or I mean, gosh, even just laying in bed at night with pillows propped up behind your head watching TV. And I don't know that a lot of people realize how damaging that can be to the structures of our spine or the connective tissue. And so I really like to help to coach and teach people how to correct some of these postural distortions and then teach them specific rehabilitative processes to correct these things in our office and at home as well.
If there was one thing, I know I'm going to put you on the spot to just kind of ask you, but is there one thing that someone who really fits what we're talking about, who's looking at the screen all the time, they probably have some neck stress right here, you know what I'm talking about, right here,
Yeah.
right? Something that we can do for that. I'm asking for a friend.
So, there are a lot of things that we can do. The first thing is to really try to focus on your posture. Think about it throughout the day. Start to notice the position of your body. And if you start to sense that you slouch or lean forward too much, work on it. Do things like roll your shoulders back.
Yeah, that's simple. I can do that.
A lot of times too is when I'll see people's work environments, I'll find that they're looking down at their computer all day. An easy solution for that is to start to prop your monitor up, maybe put some books underneath it, or the greatest solution for that would be a standing desk. And so that's something that we recommend frequently at the office so that people don't just sit all day and they can start to correct some of these postural things that they're doing to themselves by changing the ergonomics of their workstation.
So that's allenschiro.com. Did I get it?
That was
Did I
Allen's
get
Chiro.
it?
That's right.
All right, Dr. Dan, I don't want to put you on the spot. I know you've only been there a couple of months, and I know what it takes to put your whole team together and set it up. That's not a short thing. That takes some time. But have you had a chance to get into social media? Do you have somebody on your social media? Can we find you and engage with you there?
Yeah, absolutely. And so you could find me on Facebook, my office, Allen Advanced Chiropractic. We're located just across the street from Lifetime Fitness, and so that makes us pretty easy to find as far as members of our community. You can find us through Google searches. We're accessible. You can find me. If you search my name, there's not a lot of Wojnickis out there too, which makes it a little easier to locate me. But yeah, thank you.
So we're going to have all that information accompanying this in podcast and video form. So you're going to be able to reach out to him through a click and a link. Thank you so much for sharing your time with us today and helping us take a little pressure off. Right? Did you catch that? We took a little bit of pressure off just through the conversation. You made it a lot more approachable. Let's go and know that we've got a regular relationship with somebody who can keep us feeling so much better so our bodies can heal faster. Thank you so much.
Thank you so much. Thank you for having me.
Until next time.
You've been listening to the OffBeat Business Show. Find our lineup, podcast, magazine, event calendar, and sponsor information, even our membership directory, all available on the OffBeat Business app or at offbeatbusiness.com. Download the OffBeat Business app today.